Hi, my name is Trinh. I have been a hygienist for over 30 years, and I love being able to educate patients on aftercare of cosmetic dentistry, especially after bonding or veneers, because at the end of the day, you still have your natural tooth underneath that dental work, and it's really important to make sure that you're taking care of that so that your veneers will look just as great from day 1 to day 1000. The best way to care for a dental veneer is consider yourself that it's still a natural tooth. You still have to brush, you still have to floss. I would say the only caveat when you're dealing with porcelain is that you want to make sure that you're using a low abrasive toothpaste and a soft bristle brush. It's very important because you have an opportunity to scratch or etch the surface, and then it dulls that nice gleam and that shine of that dental work. So you want to be really careful to avoid things like whitening toothpaste if things are just have a very high abrasive. So I usually have a list of toothpaste that I recommend to my patients that have a very low abrasive but still be able to give them that clean feeling to make sure they're getting off the plaque. So veneers are made of porcelain, so it's not as porous as your natural teeth, but they do stain and they do, can get damaged. So I would avoid eating citrus foods or things that are anything over abundance of anything will start to damage not just veneers but your natural teeth as well. So red wine, things that will stain, a white shirt will over time your veneers or your bonding will absorb that as well. So I would say if you're looking to again not have to change out your veneers because they're dulling or staining, is that to make sure that drinking things like coffee and red wine to keep that to a minimum, especially if you're looking to again keep that looking great all the time. My best advice for keeping veneers and any kind of cosmetic dental work looking great is to have good home care and good professional cleanings. I mean, in our office, in the past, when we used to have traditional rubber cup and paste, we would have to be very limited on what we use to clean that. We use our airflow. It's extremely light, but it's very effective in removing staining and keeping that gleam of that porcelain intact. So I would say make sure that you have a professional cleaning that is done properly to make sure that it's not getting just the biofilm off, but keeping the glistening and the coating of that porcelain intact. So daily home care and good professional cleanings. We had a patient, he was in his 30s. He was really frustrated. His teeth were really short, and he never really was able to get a firm solution on how to really recreate his smile. He was a young guy, but his teeth were just grounded down, and he didn't know what he could do. And when we started with him, we were able to work with him. But I always like to tell people this case was really special because he was very patient to make sure that he went through all the proper steps, whether we recommended orthodontics, other dental work. It was a step-by-step, and that's the really way to really be able to really transform a patient. I always try to deter people from looking at the before and after and say, oh wow, that was quick, I want that like right now. But to do this case in particular properly, we had to make sure everything was in the right spot and teed up just right so that that cosmetic work at the end was what he needed and wanted, and it will last. And he is so proud of it. He smiles a ton. Everybody compliments him on his smile, and it's important to know that his smile is the most natural looking smile I've ever seen. And that's why we pride ourselves to be able to offer patients and give patients a smile that looks super natural, but really, really the smile that they love. And they're just not a walking set of veneers. How often do patients need to come in when they have cosmetic work like veneers and bonding? I would say just as often or more often than your average patient, because again, you're dealing with porous materials, porcelain glazed dental materials, so that needs to be checked and also needs to be cleaning the biofilm off of it. The last thing you want is for changes to happen and that get checked. So I would say I would normally recommend if you have any kind of cosmetic work done, I would say every 3 to 4 months would be really critical. It's just like having, a high luxury car. You want to make sure that it's running at its full capacity and full potential. And the last thing you want is something to go awry and not get that checked out at the very get-go. So I would say really prevention and really maintenance is the key to any type of dental work lasting a long time and looking great. Signs that your dental work, like veneers and bonding, may need some attention is if you see recession, where you're seeing that the edge of that veneer or that bonding starts to migrate, where you're starting to see, because usually when we start with any type of bonding or veneer or even crowns, that edge of that material should be meeting right with your gums. So as a hygienist, I'm hyper fixated on gum health. So gum health is usually where the first signs that dental work is starting to have an issue if that is not getting kept up. So we find that a lot. So that's the kind of thing that I tell people: if you're investing an X amount of money and time in, really getting a smile makeover, a smile, reconfiguration, definitely make sure you spend the time and effort in maintaining it, because the last thing you want is things to start to, become an issue. So I always say the first issue that starts up is gum health. And so as a hygienist, that's what I'm looking at all the time, all day, every day for the last 30 years. And that's really important. Not a lot of people think that enough when they get that dental work done. I think it's one and done, and they don't have to think about it again. And that gum health, whether you're looking at a natural tooth or a tooth that's been altered through porcelain veneers or bonding, really needs a lifetime maintenance. The best way to get in touch with us is to have a consultation. Like I said, our consultation's multi-level steps, and it includes checking everything from occlusion to gum health to dental health, to checking to make sure that everything's in alignment, so that when you're looking at that cosmetic dentistry, it's like the icing on the cake. You really want to make sure everything is real nice and solid before you put that very last thing on. So I always tell my patients, that's the pretty part, that's the sexy part of it. The foundation, which is your gums and your teeth health, and that's what's going to be the center stone to make sure that everything else we do at the end is going to look great and it's going to last.